Question 1. A client receives a token for every 3 correct responses on a discrete trial program. This consistently results in the client continuing to respond correctly. This is an example of reinforcement on which schedule? A. Variable ratio 3, var 3. B. Fixed ratio 3, var 3. C. Fixed interval 3, phi 3. D. Variable interval 3, vi 3. Answer: B. Fixed ratio 3, var 3. This question asks you to identify a specific reinforcement schedule. The key phrases are every 3 correct responses and consistently results in the client continuing to respond correctly. Every 3 means the requirement is a fixed number of responses, making it a fixed ratio, FR, schedule. The number 3 specifies that it's FR 3. Ratio schedules are based on the number of responses, while interval schedules, FI and VI, are based on time passing. Variable schedules, VR and VI, mean the number of responses or time changes unpredictably. Since it's a set number of responses every time, it's a fixed ratio. Do it X times, get the reward. If X is always the same, it's fixed ratio. Question 2. Your supervisor is discussing a behavior plan and mentions the importance of the motivating operation, MO. Which of the following is an example of an MO that might make a client more likely to work for a snack? A. The RBT holding up the snack. B. The client having not eaten for several hours. C. The instruction touch snack. D. A picture of a snack on the table. Answer: B. The client having not eaten for several hours. This question tests your understanding of motivating operations, MOs. MOs are environmental events or conditions that affect the effectiveness of a reinforcer and the frequency of behaviors that have been reinforced by that item in the past. Being hungry, having not eaten for hours, is an MO, specifically an establishing operation that makes food, snack, a more powerful reinforcer and makes behaviors related to getting food, like asking for a snack, more likely, holding up the snack, A. The instruction, C. And the picture, D, are discriminative stimuli, SDs, that signal that reinforcement is available if you perform a specific behavior, but the MO is what makes you want the reinforcer in the first place. MOs affect how much you want the prize. Question 3. A client's behavior plan includes a procedure for ignoring minor attention-seeking behaviors, extinction. However, you notice that when you ignore, the client's screaming gets much louder than before. This temporary increase in intensity during extinction is called A. Spontaneous recovery. B. Extinction burst. C. Behavioral contrast. D. Punishment. Answer: B. Extinction burst. This question describes a classic and often confusing side effect of starting an extinction procedure. When a behavior that used to get a payoff, attention, suddenly doesn't, the person might try harder or more intensely to get the payoff back. This temporary increase in the behavior's frequency, duration, or intensity immediately after extinction is called an extinction burst. Spontaneous recovery is a temporary re-emergence of the behavior later after it seemed gone. Behavioral contrast is when changing reinforcement in one setting affects behavior in another. Punishment decreases behavior. The behavior bursts before it hopefully reduces permanently. Question 4. You are tracking a client's engagement in solitary play, playing alone, using whole interval recording with 1-minute intervals. If the client plays alone for the first 50 seconds of an interval, but stops for the last 10 seconds, how do you record the data for that interval? A. Mark yes. B. Mark no. C. Record duration, 50 seconds. D. Record frequency, 1 instance. Answer: B. Mark no. This question tests a specific rule for whole interval recording. For a whole interval to be marked as yes, the target behavior must occur continuously throughout the entire specified interval. In this case, the client stopped playing alone for the last 10 seconds of the 1-minute, 60-second D interval. Since the behavior did not occur for the whole minute, you mark no for that interval. partial interval records if it occurs at all, momentary time sampling records at the end, and duration measures how long, for whole interval, the behavior must fill the entire time block. Question 5. You are teaching a client to wash their hands using a task analysis with 10 steps. You assist the client with steps 1 to 5 and reinforce them for independently completing step 6. Put soap on hands. Once they can do step 6 consistently, you assist with steps 1 to 4 and reinforce independent completion of steps 5 and 6. This is an example of A. Total task chaining, B. Forward chaining, C. Backward chaining, D. Shaping. Answer B. Forward chaining. This question describes a specific method for teaching multi-step tasks, a task analysis. The scenario starts by teaching the client to independently complete the first mastered step, step 6 here, assuming earlier steps are already partially mastered or prompted fully, and then adds steps from the beginning of the sequence, moving from mastering step 6 to mastering steps 5 and 6. This approach, teaching the steps from the beginning of the task analysis forward, is called forward chaining. Total task chaining attempts all steps each trial. Backward chaining starts from the last step. Shaping is for single behaviors. You're building the chain from the front and forward. Question 6. What is the primary ethical responsibility of the RBT when faced with a situation that is outside their area of competence? A. Attempt to implement the procedure but inform the supervisor later if it doesn't work. B. Inform the supervisor immediately and seek additional training or supervision before proceeding. C. Refer the client to a different therapist who is more competent. D. Decline to work with that client or on that specific procedure without explanation. Answer B. Inform the supervisor immediately and seek additional training or supervision before proceeding. This question addresses a critical ethical guideline regarding competence. RBTS must only perform services and procedures they are competent in based on their training and supervision. If you are asked to do something you haven't been trained on or don't feel comfortable doing, you have an ethical obligation to inform your supervisor immediately. They are responsible for providing the necessary training or ensuring the procedure is implemented by someone qualified. Attempting it untrained, A, or declining without communication, D, are inappropriate. Referring the client, C, is not the RBT's role. Your supervisor is the one responsible for ensuring you are trained and competent. Question 7. If a behavior decreases because a previously delivered reinforcement is now withheld, this is called A. Punishment, B. Negative reinforcement, C. Extinction, D. Response cost. Answer C. Extinction. This question asks for the principle that decreases behavior by removing the payoff. The key is that the behavior decreases because a previously delivered reinforcement is now withheld. This defines extinction. The behavior decreases over time because the consequence that used to maintain it is no longer provided. Punishment decreases behavior by adding something aversive or removing something desired after the behavior. Negative reinforcement increases behavior by removing something unpleasant. Response cost is a type of punishment. If you stop giving the behavior its usual prize and it goes down, that's extinction. Question 8. A client is engaging in aggressive behavior which is maintained by escaping demands. Which intervention strategy is most likely to be effective based on the function? A. Providing high amounts of attention when aggression occurs. B. Delivering a preferred tangible item contingent on aggression. C. Implementing planned ignoring of the aggression. D. Modifying the task or providing reinforcement for completing demands without aggression. Answer D. Modifying the task or providing reinforcement for completing demands without aggression. This question asks you to choose an intervention that matches the function, escape. If a behavior is happening to get out of demands, effective interventions often involve addressing the demand itself, making it easier, breaking it down, or reinforcing the client for completing the demand without aggression. Teaching an alternative behavior, like asking for a break, and reinforcing that. Options A and B would reinforce the behavior if the function were attention or access. Planned ignoring, C, is an extinction procedure for attention-maintained behavior, not escape. To address escape, you usually change the demand or reinforce compliance. Question 9. What is the ethical term for promoting independence and self-determination for the client to the greatest extent possible? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Fidelity. Answer: C. Autonomy. This question asks about an ethical principle related to client rights and control. Autonomy refers to the client's right to make their own choices and have control over their own life whenever possible. ABA practice emphasizes promoting independence and providing opportunities for choice to respect client autonomy. Beneficence is doing good. Non-maleficence is avoiding harm. Fidelity is being trustworthy. Helping clients make choices and become more independent is promoting their autonomy. Question 10. You are tracking data on a client's vocal stereotypy example, repeating phrases that are not conversational. You set a timer for 1-minute intervals and record if the vocalization occurs at any point during the interval. What measurement method are you using? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Duration recording. Answer: B. Partial interval recording. This question asks you to identify a discontinuous measurement method based on its rule. The key phrase is record if the vocalization occurs at any point during the interval. This is the definition of partial interval recording. You mark yes for the interval, even if the behavior only happened briefly within that time block. Whole interval requires it throughout, momentary time sampling requires it at the end, and duration measures how long. If the behavior just has to touch the interval to count, it's partial. Question 11. If a behavior occurs less often in the future because a desirable item was removed immediately after the behavior, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question asks about a principle that decreases behavior by taking something away. The clues are less often in the future, punishment, and a desirable item was removed immediately after, negative. When something the client likes is taken away as a consequence, and the behavior decreases, it's negative punishment. Taking away a client's favorite toy because they threw materials and the throwing decreases is negative punishment. Question 12. You are asked to help your supervisor conduct a functional behavior assessment, FBA, by taking ABC data. What does ABC data involve recording? A. The total count of the behavior, its duration, and its intensity. B. What happened antecedent immediately before the behavior. What it looked/sounded like, and the consequence immediately after. C. A subjective assessment of the client's mood, their behavior, and how you felt about it. D. The frequency of the behavior across different times of day. Answer: B. What happened antecedent immediately before the behavior. What it looked/sounded like, and the consequence immediately after. This question asks what specific information is recorded during ABC data collection, a key part of an FBA. ABC data is a structured way to observe and record the environmental events surrounding a behavior of interest. For each instance of the behavior, you record the antecedent, what happened right before, the behavior, a clear, objective description of what the person did/said, and the consequence, what happened immediately after. This data helps determine the function of the behavior. It's collecting the ABC chain for each occurrence. Question 13. When using a token economy system, the tokens are considered reinforcers, while the items exchanged for tokens are reinforcers. A. Primary, secondary. B. Backup, conditioned. C. conditioned, backup, D. Secondary, primary. Answer C. Conditioned, backup. This question asks you to identify the types of reinforcers in a token economy. The tokens themselves, example stickers, points, are initially neutral but become reinforcing because they are paired with access to other, more powerful reinforcers. These are called conditioned reinforcers or secondary reinforcers. The items or activities that the client exchanges the tokens, for example, iPad time, toy, snack, are the ultimate rewards and are called the backup reinforcers. Primary reinforcers are unlearned biological ones. The tokens are the learned rewards that you cash in for the real rewards, backups. Question 14. Which type of prompt is considered the most intrusive? A. Verbal prompt. B. Gestural prompt. C. Model prompt. D. Physical prompt. Answer D. Physical prompt. This question asks about the level of intrusiveness of different prompts. Physical prompts, which involve touching and manually guiding the client's body to perform the behavior, like hand-over-hand assistance, provide the most direct and hands-on help and are generally considered the most intrusive type of prompt. Verbal, gestural, and model prompts provide less physical assistance. Intrusiveness refers to how much the prompt interferes with the client's independent behavior. Question 15. You are teaching a client to sort laundry into colors. When they successfully put a red shirt in the red pile after you point to the red pile, a gestural prompt, what should you reinforce? A. The client looking at your pointing finger. B. The act of pointing to the red pile. C. Putting the red shirt in the red pile. D. Any sorting behavior, even if incorrect. Answer C. Putting the red shirt in the red pile. This question asks what specific behavior you should reinforce when teaching a skill. In teaching programs, you reinforce the target behavior or a prompted version of it if using errorless teaching. The target behavior here is correctly sorting the shirt into the designated pile. While looking at the prompt, A, or the prompt itself, B, might be reinforced during prompt training. The goal of the sorting program is to reinforce the correct sorting response. Reinforcing incorrect behaviors, D, is counterproductive. Reinforce the behavior you want to see happen again. Question 16. What is the difference between discrete trial training, DTT, and natural environment teaching, NET? A. DTT is conducted at a table, NET is conducted during play. B. DTT is structured and controlled, NET is less structured and uses the client's natural motivation. C. DTT uses reinforcement, NET does not. The DTT focuses on communication, NET focuses on play skills. Answer B. DTT is structured and controlled. NET is less structured and uses the client's natural motivation. This question asks you to distinguish between two common teaching approaches. DTT is highly structured, often conducted at a table, with specific estes and consequences presented in a controlled manner, with a clear interterritorial interval. NET, on the other hand, takes place in the client's natural environment, during play, daily routines, etc., is less formal, and often uses the client's current interests and motivation, what they want or are naturally interacting with, as the basis for teaching opportunities. Both methods use reinforcement, C, and can target various skills, including communication and play. And D, though NET is often well suited for play/social skills. The key difference is the level of structure and the use of natural motivation in NET. DTT is structured teaching. NET is teaching within natural routines. Question 17. An RBT notices that a previously mastered skill example identifying colors is not being performed consistently by the client when asked by their parent at home. What might be a reason for this, and what concept does it relate to? A. Lack of maintenance. The skill was not practiced enough over time. B. Lack of generalization. The skill is not occurring in a different setting with a different person. C. Lack of discrimination. The client cannot tell the difference between colors. D. Satiation. The client is tired of identifying colors. Answer: B. Lack of generalization. The skill is not occurring in a different setting with a different person. This question presents a scenario related to applying skills learned in therapy to real-world situations. The skill was mastered, so maintenance, A, over time might be okay within therapy, but the issue is it's not happening reliably with the parent at home. This means the skill hasn't generalized to a different setting, home, and a different person, the parent. Discrimination. C is about telling stimuli apart, which they did in therapy. Satiation. D is about being tired of the reinforcer. The problem is the skill is stuck in the therapy context and isn't transferring. That's a lack of generalization. Question 18. What is the ethical guideline regarding discussing clients with others? A. You can discuss clients with anyone who works in the same field. B. You can discuss clients with other RBTS from your company if they work on the same case. C. You can discuss clients with family members if the family asks questions. D. You can discuss general client behaviors in a public setting if you don't use their name. Answer: B. You can discuss clients with other RBTS from your company if they work on the same case. This question addresses confidentiality in daily practice. Client information is confidential and should only be shared with individuals who are part of the client's treatment team and have a professional need to know. This includes other RBTS from your agency who are specifically assigned to that client's case. Discussing with anyone else. A. With family without specific authorization. C. Or in public where you could be overheard, even without names. D. Or violations of confidentiality. Keep client discussions limited to the necessary team members in a private setting. Question 19. When working with a client, you should prioritize using reinforcement that is: A. Easiest for you to deliver. B. Preferred by the client and effective in increasing the target behavior. C. The least expensive option available. D. Only edible items. Answer: B. Preferred by the client and effective in increasing the target behavior. This question asks about selecting effective reinforcement. The best reinforcers are those that are highly preferred by the individual client, identified through preference assessments, and actually work to increase the desired behavior demonstrated by data, while ease of delivery, A, and cost, C, might be practical considerations. They are secondary to the reinforcer's effectiveness and appropriateness for the client. Edible items, D, are one type, but variety is important. Use rewards the client actually wants, and make sure they help the behavior grow. Question 20. You observe a client engage in a challenging behavior. To collect ABC data, the C you record should be: A. Their emotional reaction to the behavior. B. What happened immediately after the behavior occurred. C. The presumed function of the behavior. D. A subjective description of how the client seemed to feel after the behavior. Answer: B. What happened immediately after the behavior occurred. This question tests what specific information goes into the C column of ABC data. The C stands for consequence, which is the environmental event that happens immediately after the behavior occurs. This is an objective description of what happened, not your feelings. A. The inferred function. C. Or the client's presumed feelings. D. You record the immediate consequence to help determine the function later. Record what happened right after the behavior. Question 21. What type of measurement involves recording the total time that a specific behavior occurred during an observation period? A. Frequency. B. Duration. C. Latency. D. Momentary time sampling. Answer: B. Duration. This question asks for the specific measurement method used to track how long a behavior lasts. Recording the total time that a specific behavior occurred is the definition of duration recording. Frequency counts instances. Latency measures time to start after a cue. Momentary time sampling is checking at specific moments. If you time the behavior from beginning to end, you're measuring duration. Question 22. You are teaching a client to follow the instruction, "Give me color." You present the instruction and place a red block, blue block, and yellow block on the table. The client must select the correct block based on the color named in the instruction. What type of skill is this primarily targeting? A. Tact. B. Mand. C. Intraverbal. D. Listener responding. Answer: D. Listener responding. This question asks about a category of verbal behavior where the client responds non-verbally to spoken language. The client is listening to your instruction, "Give me color," and then performing a non-verbal action, selecting / giving the correct block. This is a core example of listener responding. Tact is labeling. Mand is requesting. Intraverbal is conversational. Understanding and acting based on what is said is listener responding. Question 23. What is the ethical principle that involves ensuring that services are delivered fairly and equitably without bias? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Justice. Answer: D. Justice. This question asks about an ethical principle related to fairness. Justice in ABA ethics involves ensuring that services are provided equitably, considering individual needs and avoiding discrimination based on factors like race, ethnicity, gender, socioeconomic status, or disability. It's about fair and impartial access to and delivery of effective treatment. Beneficence is doing good. Non-maleficence is avoiding harm. Autonomy is about choice. Treating everyone fairly is the principle of justice. Question 24. If a client engages in a behavior, and as a result, something they dislike is added to the environment immediately after, and this causes the behavior to decrease in the future, this is A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: C. Positive punishment. This question asks you to identify a principle that decreases behavior by adding something unpleasant. The clues are causes the behavior to decrease in the future, punishment, and something they dislike is added immediately after, positive. When an aversive stimulus is added following a behavior, and this makes the behavior less likely to occur again, it's positive punishment, getting a speeding ticket. Adding something you dislike, the fine / points, after speeding, behavior, and speeding less often is positive punishment. Question 25. When conducting a preference assessment using a paired stimulus, forced choice, method, how is the assessment conducted? A. Items are presented one at a time, and engagement time is measured. B. Multiple items are presented, and the item chosen is removed for the next trial. C. 2 items are presented at a time, and the client chooses one. Each item is paired with every other item. D. The client is allowed to interact with multiple items freely, and engagement time is observed. Answer: C. 2 items are presented at a time, and the client chooses one. Each item is paired with every other item. This question describes the procedure for the paired stimulus preference assessment. In this method, you present items 2 at a time, a pair, and ask the client to choose one. You present every possible combination of pairs from the set of items being assessed. This method provides a clearer hierarchy of preferences than single stimulus. Single stimulus is A. MS-DOO is similar to B, but without replacement. Free operand is D. Paired stimulus means presenting items in pairs. Question 26. What is the purpose of thinning a reinforcement schedule after a skill has been learned? A. To increase the client's dependence on the reinforcer. B. To make the behavior more fragile and easier to extinguish. C. To maintain the behavior over time and make it more resistant to extinction. D. To transition to a continuous schedule of reinforcement. Answer: C. To maintain the behavior over time and make it more resistant to extinction. This question asks why we reduce the frequency of reinforcement once a behavior is learned. Thinning a schedule means moving from reinforcing every instance to reinforcing only some. This makes the behavior more durable and likely to continue even if reinforcement is not always available, meaning it's more resistant to extinction. It doesn't increase dependence, A, make it fragile, B, or transition to CRF. D, which is the opposite of thinning after learning. Thinning helps the behavior stick around even with less frequent rewards. Question 27. What is the ethical responsibility of the RBT regarding documentation? A, to only document positive behaviors. B, to include subjective opinions about the client's family. C, to ensure all documentation is accurate, objective, and completed in a timely manner. D, to discard session notes after 1 week to maintain privacy. Answer: C, to ensure all documentation is accurate, objective, and completed in a timely manner. This question addresses ethical requirements for documentation. RBTS must maintain accurate, objective records of client behavior, progress, and sessions. Notes should be based on observable facts, free from subjective opinions, and completed promptly after the session according to company policy. Omitting challenging behaviors, A, including opinions, B, or discarding notes prematurely, D, are unethical and violate documentation standards. Be accurate, be objective, and be timely with your notes. Question 28. If a client is learning to match objects to pictures example, given a picture of a ball, they select the real ball from a set of toys. This is primarily targeting A, manned, B, tact, C, listener responding, D, visual perception matched to sample. Answer: D, visual perception matched to sample. This question describes a specific type of visual discrimination task. The client is presented with a sample stimulus, the picture, and must choose the corresponding matching item, the real ball, from a set of options. This procedure is called visual perception matched to sample, VPMTS. It involves visual discrimination and matching skills. Manned is requesting, tact is labeling, and listener responding is following verbal instructions to identify items. Matching a visual sample to another visual item is VPMTS. Question 29. When implementing a procedure that involves planned ignoring of a challenging behavior, it is essential to first determine that the behavior is maintained by A, escape, B, access to tangibles, C, attention, D, automatic reinforcement. Answer: C, attention. This question connects a specific intervention strategy, planned ignoring, to the function it targets. Planned ignoring is an extinction procedure where you withhold attention contingent on the challenging behavior. This is only appropriate and likely to be effective if the behavior is actually maintained by receiving attention. If the behavior is maintained by escape, access, or automatic reinforcement, ignoring it won't remove the reinforcement and thus won't likely decrease the behavior. It could even make it worse. Extinction burst. You only use planned ignoring if attention is the function. Question 30. What is the primary role of the RBT in the development of a client's behavior intervention plan, BIP? A, to write the BIP based on client needs. B, to assist the supervisor in collecting assessment data that will inform the BIP. C, to make final decisions about the procedures included in the BIP. D, to gain consent for the BIP from the client's family. Answer: B, to assist the supervisor in collecting assessment data that will inform the BIP. This question clarifies the RBT's contribution to the development of the BIP. RBTS are implementers, not designers. However, they play a crucial role in providing the supervisor with the necessary information to create the plan by collecting accurate assessment data, such as ABC data, frequency counts, or duration data. As directed by the supervisor, RBTS do not write the BIP. A, make the final decisions. C, or gain consent. This is the supervisor's role. Your role is to be the data gatherer that informs the supervisor's plan. Question 31. If a client is engaging in a behavior that is maintained by gaining access to a preferred item or activity, what type of differential reinforcement procedure might be used to teach an alternative behavior? A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRA. D. Any of the above. DRO, DRI, or DRA, if designed by the supervisor. Answer: D. Any of the above. DRO, DRI, or DRA, if designed by the supervisor. This question asks about differential reinforcement. DR, procedures and their application based on function. All types of DR involve reinforcing a desired behavior or the absence of the problem behavior, while withholding reinforcement for the challenging behavior. If a behavior is maintained by gaining access, you'd reinforce an appropriate alternative behavior, like asking politely, using DRA, reinforce a behavior incompatible with the challenging one, the DRI, or reinforce any other behavior when the challenging one isn't happening. DRO. The specific type of DR would be chosen by the supervisor based on the client's needs and the target behaviors. While DRA is a common fit for teaching a replacement skill, any form of DR could be used if designed by the BCBA. The supervisor picks the specific type of DR. Question 32. When teaching a client to wash their hands, each step of the task analysis example, turn on water, wet hands, get soap, serves as a cue for the next step. This sequence of cues and responses is called a behavioral momentum, B. Stimulus-response chain, C. Prompt hierarchy, D. Discrete trial. Answer: B. Stimulus-response chain. This question asks about how the steps of a task analysis function once learned. In a well-learned chain, completing one step produces a sensory change in the environment. Example: hands are wet after turning on water. That acts as a discriminative stimulus, SDE, signaling that the next step, get soap, should be performed. This linked sequence of SDs and responses is called a stimulus-response chain. Behavioral momentum, A, is about continuing a task sequence after easy ones. A prompt hierarchy, C, is about types of prompts. A discrete trial, D, is a single teaching unit. The steps of a task analysis become a chain of signals and responses. Question 33. What is the purpose of pairing yourself with reinforcement? A, to decrease challenging behaviors immediately. B, to become a reinforcing presence to the client and build rapport. C, to teach the client to share preferred items. D, to make the client dependent on the reinforcer. Answer: B, to become a reinforcing presence to the client and build rapport. This question asks about the goal of pairing. Pairing involves associating yourself with items and activities the client loves. By consistently being the person who brings or provides access to reinforcement, you become a conditioned reinforcer yourself, someone the client enjoys being around. This builds a positive relationship, rapport, and makes the client more motivated to interact with you and participate in learning activities. It's about making yourself a positive part of their environment. Question 34. Which ethical principle requires RBTS to operate within the boundaries of their training and supervision? A. Integrity. B. Fidelity. C. Competence. D. Beneficence. Answer: C. Competence. This question asks about the ethical principle related to your skills and training level. The ethical principle of competence requires behavior analysts and RBTS to provide services only within their scope of training and expertise. This means you must be properly trained on the procedures you use, seek supervision when needed, and not attempt tasks you are not qualified to perform. Integrity is honesty, fidelity is trustworthiness, and beneficence is doing good. Working within your training and seeking help when needed is about professional competence. Question 35. When collecting baseline data on a skill acquisition program using probe method for a task analysis, you: A. Prompt the client through the entire task analysis and record independent steps. B. Present the instruction for the task and record which steps the client completes independently without prompting. C. Present reinforcement for each correct step completed independently. D. Record the total time it takes to complete the task. Answer. B. Present the instruction for the task and record which steps the client completes independently without prompting. This question asks about collecting baseline data for a task analysis using the probe method. In a probe trial, you present the instruction for the entire task analysis or the specific step being probed, and record whether the client can perform each step independently without any prompts. You do not provide prompting or reinforcement during a pure probe trial. The goal is just to see what they can do on their own right now. Prompting throughout, A, is more like teaching. Reinforcing steps, C, is part of teaching, not baseline. Measuring total time, D, is duration, not the standard probe method for a TA. A probe is a test to see what they can do by themselves.